Well, good morning, good afternoon, or good evening to everyone online. It's wonderful to have you here. My name is Mark O'Brien, and I'll be facilitating with my colleagues from the school this webinar on healthcare leadership under stress. We often talk about crises, I think, as a discrete event. You know, we've had a pandemic, it might be a cyber attack, it might even be in particular countries a workforce shortage, even natural disasters or conflict. But I think what we're hearing at the school and through our networks is that many healthcare leaders are not experiencing these as individual separate events, but in fact rather as overlapping and interacting pressures that impact them in their leadership and in their systems. So the leadership challenge is no longer simply to respond to one emergency and return to normal, but in fact it can be to lead in conditions where instability is the norm. And depending on where you are in the world, this may be something that you're very familiar with or something that you're coming to terms with. So today we want to explore three linked questions. First, what's really happening to healthcare systems around the world under these pressures? What kind of leadership mindset's required? And thirdly, how do we sustain resilience, our value, our purpose as leaders, when resources are constrained, conditions are difficult, and uncertainty is high? So as I said to you, my name is Mark O'Brien. It's my great pleasure to be leading this webinar today, but I'm joined by two wonderful colleagues. Sir Ashley Bloomfield is a public health physician with nearly 20 years experience in senior leadership roles, including 10 years as a chief executive. He was the New Zealand's Director General of Health from 2018 to 2022 and led the country's response to COVID. And my dear friend, Dr. Eleanor Murray, is an academic based at the University of Oxford with 20 years experience as a healthcare leader and a hospital board director. Eleanor's research is on organisations and systems change, and particularly in resilience, and she teaches executives internationally. So it's wonderful to have Ashley and Eleanor join us tonight. So welcome, Ashley, welcome, Eleanor. I'd like to start off, first of all, with you, Ashley. You've had a wonderful career, and from your experience as Director General of Health in New Zealand and your work in global public health, what feels different about the current global context for healthcare leaders compared with, say, previous periods of crises?
Thanks very much, Mark, for the introduction, and hello to everybody who's joined the call. Well, those challenges that we're facing in healthcare systems worldwide are not new, and they'll be known to all of you. Aging populations, workforce and finance constraints, increasing complexity of care. And then, of course, the pandemic came along in 2020. It didn't create these challenges, but it certainly accelerated and amplified some of them in most of our countries. I dare say aging populations are by far the biggest driver of increased cost and care complexity. And the challenges, of course, most of our healthcare systems continue to be based on models of care that are, you could say, hospital and healthcare professional centric. And we know we need to shift those models of care, but there's a lot of inertia in the system. And of course, some of the new challenges that really add to that sense of, there is this term polycrisis. I'm not sure I'm a big fan of it, but they add additional challenges and therefore how we need to lead is the rise of harmful, inaccurate information, trust declining generally in countries, although not, I should say, in science and scientists, despite the common media reporting on that. And the big thing is this greater unpredictability in our international environment, and I'm sure we'll touch more on that.
Thanks very much, Ashley. And Eleanor, you look at healthcare systems, particularly with a resilience and systems leadership lens. So how do you interpret this idea of overlapping or compounding crises?
Thank you, Mark, and hello to everyone on the call. So from a resilience lens, what I notice is that when crises overlap, the effects of one crisis interact with the others, which ends up reducing the system's manoeuvrability and causing the next shock to land on a system that's already quite depleted. And when you have a health system that's brittle in this way because it's been operating too close to its limits for some time, maybe due to the longer term strain of workforce shortages, or increasing demand or financial constraints, further disruption can really compound the situation and expose the system's vulnerabilities. And I think from a systems leadership lens, it's important that we can step back and view the whole system to make sense of the emerging patterns from these overlapping crises. And this awareness helps us to build a shared picture of the risks, the vulnerabilities and the capacities and capabilities across the system.
Yeah, thanks, Eleanor. It's interesting when you think of that brittleness. Ashley alluded to the challenges of information, and in previous times, as I think about what healthcare leaders had to contend with, misinformation has always been there, but now it has a microphone or a loudspeaker that allows it to undermine trust and undermine confidence. And, I think we hear from health leaders across the globe that, workforce, our people who are on the front line, not only are they having to do the actual technical work of providing care, but they spend a lot of time actually correcting misinformation or actually dealing with the fallout of misinformation. And it's probably at a time when we are, as you say, the most brittle as we face these sort of compounding crises. So I think, everyone's got their own AI story, but for me, in my thinking, I feel for the front line having to deal with that level of misinformation, and then of course as leaders how we support them when they come across conspiracy theories or anything that undermines trust in the wonderful people who work in healthcare. So Ashley, I think that leads nicely into this challenge of one of my, I think you've heard me say at Oxford, any leader can create value with lots of resources and a calm environment. But the real challenge is how do you lead in uncertainty? What's the mindset? What's the judgment? What's the way you turn up as a leader? So, you led a whole nation during a public health emergency. You must have been required to make decisions before all the evidence was complete. So how should we think about decision making when evidence is emerging rather than settled, when the stakes are very high? And of course, the public expects a certainty. They think, well, you tell us the answer, and of course, sometimes it's not as simple as that, is it?
No, well, leading's never simple, and of course, everything is magnified enormously when there is a crisis, and particularly something like a pandemic. The former US Secretary of State Colin Powell talks about this 40-70 rule broadly, that you should have at least 40% of the information you need to make a decision, or in my case, it was providing advice. But if you've got more than 70%, you probably have waited too long. And it's important as a leader to remember no decision is still a decision. And in crisis situations where there is only limited information, what's most important, and we certainly found this through the pandemic response, and I think it was borne out not just in Aotearoa, New Zealand, but in other countries, that building trust through excellent communication was critical. And just being open and honest, including about what you do and don't know, and what you're going to do to fill in the gaps in your knowledge. And at those times, how you come across as a leader is really of prime importance. That is, the leadership behaviours that give people a sense of reassurance and confidence. They don't mind being told, I don't know, as a response to questions, but what they're looking for are signals. So being calm, predictable, demonstrating that you've got a plan, or you're making a plan, and also giving people something to do, even if it is a simple thing that they can do, so they have a sense of agency. And so our experience in New Zealand through COVID was that the public can live with uncertainty if they trust the decision makers. And I think of trust, I guess it's a final comment here, is built on honesty, competence, and reliability. And I find that triumvirate of sort of the features of trust as really important to think about as a leader.
Yeah, that's very profound. Ashley, I have a quote that I use in one of my lectures at the school from Charles Riley, who was one of the founders of the Stanford Business School. And it's actually one of my screensavers. And it is leaders are signal generators who reduce uncertainty as to how to act. And I think you touched into something I feel very strongly about, that, particularly with people with when they feel they may not be as experienced enough, or they don't have enough information or enough knowledge, or they are emotionally in a difficult place. We know that they turn up trying to do the right thing, but what is the right thing in this particular circumstance? And they look to the leaders for that signal to say, so how do I do this? And people live with uncertainty when they come to work, no matter how skilled they are. And we may not always get it right, but part of our job is to reduce uncertainty, and that's particularly the case in times of crisis or challenge, which we have at the moment. Um, so I think it's really interesting when we start thinking about that resilience under sustained pressure, because Eleanor, I know this is something you've got a very passionate view on. It's often discussed as if resilience is some personal trait. We have, of course, we all have personal resilience, but in healthcare, we also have to think about organizational resilience and system dimensions to resilience. So how should leaders think about resilience at these different levels, not just at a personal level?
I think that's a really good question because there's a real tendency in healthcare to ask individual healthcare workers to be more resilient, which shifts the responsibility onto those people who end up absorbing the strain, rather than acknowledging the sort of broader role that organisation and systems resilience can play. And so, as you say, I'm really passionate about encouraging people to think from an organisational perspective rather than just an individual perspective. We know the research shows that many resilient people do not make a resilient organisation, so we do need to think at the organisational level. I think the importance is to aim to transition from a reactive to a proactive approach that incorporates anticipation of what's coming towards us from the future, adaptability, capacity building, and capability development, which incorporates things like having a learning approach and having a positive culture to sustain and improve the organisational system in the longer term.
Yeah, that's great. And actually, if I could throw to you, just from a public health leadership perspective, how do you think leaders sustain themselves and their teams when pressure is really intense and prolonged?
Well, I dare say, public health is a long game, and for those who are on the call who work in the public health area as opposed to the sort of the clinical care area, we know that impacts of population-wide measures can take years to become apparent. So you've got to really maintain that focus on outcomes, and signaling waypoints is really important to help maintain focus and effort. I think of tobacco control as a great example here. While it may take over 10 years to see impacts such as reduced cardiovascular disease or cancer rates, we can quantify quite accurately the impact of smokers quitting with the evidence that's available. And so we can sort of document that progress even before we see the impacts on life expectancy for people who do quit smoking. Of course, that's less so in a crisis situation, such as a pandemic, where public health measures like restrictions on movement or vaccination have a much more rapid and immediate and measurable impact. The challenges are different, and people are often highly motivated with a clear and strong sense of collective purpose. And so it's possible and important to really capitalize on that. And the leadership responsibility in this situation is really making sure there's a deliberate focus on people's well-being. And from our experience in COVID, is dedicating senior leaders with the responsibility to oversee pastoral care. And as senior leaders in a crisis response, it's a really important leadership behaviour to model this by taking breaks, demonstrably looking after your own well-being, and also just being open about the stress and its impact that it might be having, and encouraging people to regularly just check in on each other and notice when others are struggling, and don't be afraid to ask, what I'd say, the smallest and largest question you can ask someone: are you okay?
Yeah, no, that's really, really thoughtful, Ashley. And I think, for some of us who've been in healthcare for a very long time, I think there's a tendency to think, oh, nothing ever changes. But if you look back over a long career, there's been enormous change in healthcare in the last 10, 20, 30, 40 years. And yet when you're on the ground day to day, it feels like nothing's changed. And I think sometimes it's very hard when you're in a long game like public health or primary care or prevention to realize, to actually keep that longer term focus because you're faced with the sort of omni-crisis of every day of rosters and resource constraint, and you sometimes can lose sight that you're actually doing some really terrific things that, when you
Mm.
look back 5, 10, 15 years ago, you can actually see demonstrably measurable change that didn't feel like it at the time. And I think many healthcare leaders who had some longevity feel that way, that it can be very, when you're in the trenches, if you like, day to day, you feel like you're making no progress. So I should just remind everyone, I can see people in the chat. It's so lovely to see the enormous range of people from around the world. We're so excited to have you with us to talk about this important topic. And you're very welcome to put some questions into the chat. We have kept some time at the end to try and answer your questions, but I'll be monitoring it as we go, and we'll try and incorporate some of the thinking into the questions and perhaps even specifically ask until before we get to the end. But I'd like to move on to this really interesting area of value creation because I made the comment earlier that one of my favorite lines is any leader can create value if you give them more resources and a calm environment. But it's a real measure of great leadership, isn't it, when you can create value when things are actually under challenge, or particularly where you've got stable or in the case, particularly in growing populations, when you actually divide the resources by the growth of the population, in real terms, you're actually reducing resources. So, Eleanor, I might start with you. Many healthcare systems are facing this difficult combination. There's rising demand, it might be short workforce shortages, it might be natural disasters that take years to recover from. It may be conflict, it may be financial pressure, it may be in many countries an aging population. How should leaders think about value creation in these sorts of environments where resources are constrained or even declining?
Yeah, thank you, Mark. I think I really feel that we need to think in a more joined up way about value and particularly take a more holistic perspective on what creates value for patients or clients in the context of their whole lives. Um, I think one of the challenges in healthcare is that we tend to want to describe outcomes in medical terms, but for patients, it's actually about, for them, it's about quality of life improvements. And I think making that shift helps us to see a broader perspective. So I see true value creation as being measured across care pathways that operate through multiple care settings. And I think as systems leaders, we need to work collaboratively across the system to reframe and reconceptualize care involving patients, communities, partner organisations and local government, amongst others. And I think this is really exciting and challenging work, but it does need a lot of courage, persistence and endless patience, having been involved myself. But we can see a reduced burden on the health system when this sort of joined up care occurs. And one example, I think, which touches on some of the comments in the chat, is the NHS Right Care Diabetes pathway, which I think is a really good example of continuous proactive chronic disease management, which has actually resulted in population level improvements, including a reduction in emergency admissions and lower mortality rates. So that work up front to have early interventions like education packages and regular checks results in, much lower costs further down the line.
Yeah, it's interesting, Eleanor, isn't it? Because we know that many systems are starting to look at very, very cheap methodologies with wearables and messaging apps to actually try and move upstream and get those preventative messages out. And not just messages, but actually early monitoring or early interventions by prompting or nudging. And, they don't have to be expensive. So, as you say, that joined up thinking and sort of thinking, considering the health of the population from cradle to grave, and how we can intervene upstream, right? Because it's interesting, just looking through the chat, there are many questions about how can we as leaders shift from reactive sort of, downstream um, care, which of course is expensive and in terms of return on investment is often nowhere near as high as upstream preventative work or public health work. And I think that's starting to put a bit of thinking around that in your answer. What about you, Ashley? What's your thinking about value creation in times of shortages and resource constraint?
Yes, thanks, Mark. And just to build on what Eleanor has said, put simply, I think of value in terms of impact over cost. And too often, as senior leaders, we focus on the cost element. And I've certainly had that experience as a chief executive or a member of an executive team where we spend too much of our time just trying to find the next dollar to save. This is a really common experience. And we can sort of shift our attention focus on to impact or benefit by considering, what are the key dimensions, as Eleanor has said, the things that matter to people actually, to people to keep well or when they're using services, and things such as quality and applying quality improvement initiatives to improve safety and the reliability of care. We can and should have a focus on equity, and that includes equity of access to, experience of, and outcomes from care. Leading on from that, measuring, reporting care outcomes, really being able to demonstrate the benefits of the care we're providing, applying PDSA approaches to trialing new models of care that are less costly, that might produce similar or even better outcomes. And these are all things that, as leaders, we are both able to deploy, but also we've got this responsibility to deploy. So, as systems leaders, we're also really aware of the complexity of running healthcare organizations and of the overall system. So we need to carefully consider and think ahead about the flow-on impacts of changes onto those people using services, care workers, and of course costs. Likewise, we also know that complex systems function well if relationships are strong and enduring, and individuals are clear about what their responsibilities are. So, in that regard, one of the most effective ways of ensuring value in the system is to ensure that we're engaging well with our workforce, with our healthcare workers, and with our communities and service users, in particular involving them in decision making where there are difficult choices to make, because time after time, studies show people don't shy away from making those choices, and they would rather be involved than not.
Yeah, actually, that's a really good point. And Matthias in the chat has basically raised that issue. His question is really around at the senior level in healthcare and in health politics, that we're at risk of losing public and workforce trust by dodging these difficult questions, particularly around austerity or resource constraint. And I know we've all had conversations about this concept of perhaps good enough healthcare, that what we see is populations being told that they can have everything. And in fact, that's never going to be the case. There's always going to be some form of rationing, some sort of prioritization, and inevitably, in any resource constrained environment, we can't avoid the fact that there will be, from the public's point of view, perceived winners and losers. And if we pretend that that's not true, or we don't communicate around that sensitively and try and explain that, then we do lose trust. And Matthias makes that point. So I think what you're alluding to is the fact that you made that point about good communication, but sometimes there's a risk of thinking good communication is good communication about good news. Um, and some of the best communication you do is around unpleasant news or news that people don't want to hear. And so, as you say, that's where trust comes into it. And as we know, in complex adaptive systems like healthcare, um, best practice is all. There's really no such thing as best practice. There is really only emergent practice. And unless you've got the sounding boards, the ways of bringing in data from so many different points of the system, you'll never actually navigate it. You'll actually just be implementing, so-called solutions. And I remember a great conversations we've had offline, but people love to hear solutions, but if you think you've got a solution to a complex adaptive system, then you actually haven't asked the right question. There's never a solution. What there are is
Yeah,
a
it's
range of options,
yeah,
and
it's
each
a
of
good
those
point.
options have benefits and disadvantages. Yeah, please continue on that.
It's a good point, Mark, and really delivering healthcare effectively is always about making trade-offs, and actually, our health workers are doing that. Our workforce is doing that day in, day out, and thinking about those trade-offs, and of course, often making those or discussing those trade-offs with individual patients or their families. And I had, an interesting experience just to share when I first became a chief executive, and the clinical director of surgery came to see me, and he said, "See, there's a big pile of business cases on your desk there, and for goodness sake, can you just make a decision? If it's no, tell us, and we might be grumpy, but at least we can know that, all right, we can move on to the next thing. And if it's a no, give us a reason and explain why, or if it's a not at this time, tell us the reason." But people, I think, and certainly our patients and the people we're working with, if anything, it's uncertainty that is the hardest to live with. So I think being open about the trade-offs and giving certainty, even if it does, as you say, involve saying no, is better than running hot and cold or not actually being upfront about the trade-offs that need to be made.
And Lev in the chat makes that point about the impossibility of thriving in complexity in a VUCA environment, and talks about how you have to step out of the bubble of the illusion of control. And I think that's when we get suckered into the, oh, this is best practice, or this is the right way to do things. And of course, it's by definition, if there is best practice or the right way of doing things, we're not in a complex situation. Um, it's actually a definitional issue. Eleanor, anything to add on to that, particularly
Yes, I
with
was
a
just thinking that it takes time making these changes in healthcare, and particularly when you're sort of doing things like I've studied integrated care and bringing together sort of health and social and voluntary services can take 10 to 15 years. So what it requires is the sort of a set of guidelines or frameworks that healthcare workers can use, but for them to be able to adapt within that. So it's not about controlling the health system, it's about putting up sort of frameworks and guidelines that healthcare workers can work within and adapt to, and also where healthcare is driven by political cycles, they also need to adapt as well to sort of take account of the changes in priorities of political parties.
Yeah, and it's a really good point, Eleanor, because I think one of the challenges I think I found as I became a healthcare leader, I'm sure I'm not alone, but there is this element of comfort with uncertainty as an individual. That this is actually if you're just sort of waiting, well, one day everything's going to be fine and I'll feel very comfortable, and it's sort of like it's just not the world we're in. And sometimes we have our students come to Oxford, don't they? And you get the sense of, well, we've come to Oxford because now we'll know the answer. Um, and we often say that what we hope we do very well is actually just ask better questions rather than actually give answers. But I think it leads nicely into it because we've got leaders from all parts. Senior leadership in healthcare can be anything from politicians to public servants or board members, governments, senior executives. I know all three of us have had board roles as well as executive roles. And I just wanted to quickly touch on the area of governance. And, for those of us who are on boards, governments, senior executives, Ashley, what does governance look like when we're in these volatile environments and decisions need to be made quickly?
Yeah, well, it's hugely challenging, and a couple of thoughts just to share. In particular, thinking about and reflecting on the COVID experience, but not just that. And in that crisis situation, we found a really important role for governance, a real value add was that real-time assurance. So much more regular and quite participatory meetings than you would normally expect from a board, and that included the reporting and monitoring. And for example, when we were rolling out our vaccination program, our governance board or group really was meeting on a weekly basis. And as part of that, we had a couple of real-time, people who were providing real-time assurance, which meant that as issues were raised, and the risk register was just red all over, but as issues were raised and problems were confronted, there would be this active working with team members to ensure that they had the resources and support to manage what were large risks, and those were pretty much impossible to mitigate or reduce for long, long periods. So that sort of more active real-time assurance, almost formative in a formative way. And then, of course, one of the key roles of governance is strategy. And so whilst it's a real challenge during a crisis when the response is intense and can feel all-consuming, and people also gravitate towards the response rather than stepping back and looking from the balcony. And this is a key role for boards and governments, senior politicians and senior executives to keep considering the range of what if options and do as much as possible to just test these and set the response up to be able to switch quickly if a particular what if scenario starts to play out.
That's right, Ashley. And it's really interesting, as you know, at Oxford, say business school, it's the scenarios was essentially the idea, the concept of scenario planning and strategy really originated at the school and with some senior academics, and it's a big part of the way we think and teach strategy at Oxford, as Eleanor well knows. But Eleanor, I think that's so. If once we get down into that operational level, because interestingly, looking on the chat, people are, very conscious of the fact that you need to be connecting with people on the front line. And so, we've talked a little bit about, you've talked a little bit about organizational resilience, systems resilience, but there's also an element of team resilience and team functioning, isn't there? And so at an operational level, what do you think leaders can do to help teams function well when the system's under really sustained stress?
Yeah, I think this is a really good question. I think a critical role for leaders is to protect psychological safety and to offer visible support so that team members feel able to speak up when they have concerns and their concerns can be heard and acted on. Because when you're in that fast-moving situation and things are very stressful, if people don't feel they have a forum where they can raise concerns honestly and openly, it can cause people to have burnout. And so I think trying to prevent that is really important. And the challenge of sustained stress is that everything feels urgent. So as a leader, if we can be explicit about priorities, being clear what can be paused, and how to manage or escalate trade-offs such as safety versus performance, then we can really help teams. And I think being able to give teams permission to adjust and adapt within clear boundaries, instead of requiring a lot of upward decision making, can also be really supportive. So I think the critical thing, and I think Ashley's touched on this as well, is that maintaining and strengthening team relationships is critical when facing sustained stress. And you can do this through sort of mutual support or clarity around roles, because often during sort of sustained stress, roles can become blurred and that can cause tensions and conflict. And respectful challenge, so encouraging challenge but ensuring it remains respectful. And I think as leaders, if we can stabilise routines, so that at least there's something that people can hold on to as a sort of consistent element throughout the stressful period, and maintain really excellent communication, that can help to provide a sense of consistency and reduce conflict.
Yeah, I think that's really wise, Eleanor. I mean, I as I think about what healthcare leaders tell me, when you get down on the front line, there are many people who feel they're almost in moral peril at times, that they're actually having to make decisions that seem to go against their own personal values. And sometimes that's an issue of framing. Sometimes, they actually have magical thinking that, everything has to be perfect all of the time. And we all know that, that's not going to happen. But I think that sense of being in moral peril or finding yourself in a workplace that's incongruent with your values and the way you see yourself in the world contributes to that burnout, doesn't it? And I think that
Yeah.
ability to, yeah, please.
Well, this is something that I've done research on. Is in an intensive care setting, we looked at people who tended to be more pragmatic and people who were more perfectionistic about the way they delivered care. And the people who were more perfectionistic ended up having a lot of cognitive dissonance and really struggling to sort of not end up in burnout because they felt that their values were consistently being challenged by the need to deliver care and sort of having to compromise on the way they delivered care.
Yeah, no, that's really good. In fact, Bobby's asked a question here around the how we navigate clarifying and maintaining scope of healthcare services, including public health services, where there's growing demand in response to not just organic, pathology, but things like psychosocial trauma or justice issues or other matters that are actually as much in the social domain as they are in the sort of pathology domain or organic pathology domain. And I think a compatriot of mine, Sir Michael Marmot in the UK, is a great writer and thinker about the social determinants of healthcare. And I think in a more holistic way, um, we have a job to answer Bobby's question. I think we have a job to educate. I think there are sections of the population, sections of our political classes, sections of our bureaucratic or civil service classes who actually see health as disease management. And we have a job as healthcare leaders to make sure that the conversation is very broad, in my view, Bobby, that we see that we are just as strong as advocates for things like housing, education, the education of young women, access to clean water, a sense of hope and cohesion in the society. These things can be more important or equally important to the health of a nation as what the state of the local hospital or clinic is. And I think that's the challenge, isn't it, Bobby? Because you know, uh, particularly clinicians get very passionate about their particular specialty or their particular interest, and their advocacy sometimes can be very narrowly defined around their particular service or their particular discipline rather than advocacy around what's needed. And Eleanor, you've seen that, haven't you?
Yes, I mean, this is why I think systems leadership is so important because with the
Mm.
systems leadership, you're looking at the intersection between all these different sectors in society. So you're looking at the intersection of education and health and housing and all these factors which all contribute towards the overall health of the population, as I'm sure, Ashley, you know only too well.
Mm. Yeah, this is a really important topic, and I think the point's well made by Bobby that, if we think about mental health disorders and we're seeing increases in prevalence, particularly of things like anxiety and particularly amongst young people, and this is a global phenomenon, and of course there's plenty of debate about what might be driving that. But the response too often is we need more services rather than looking at what is it that is happening across society and what of the response needs to actually sit outside of healthcare services. And of course, again, if we look at the experience from the pandemic, in many countries, we found that health services were either not able to cope or they played a relatively minor role. And New Zealand was one of those for large parts of the pandemic because it was these broader public health measures that actually were the most important and the most useful to protect people. The the key lesson, one of the key lessons I took away from the pandemic was actually, and it's just was a nice reminder that the biggest, of course, the biggest workforce out there, the biggest healthcare workforce are people. And it was actually the response of individuals and families and communities and neighborhoods and how they acted and took on board that broader public health advice. And so I guess if we think about the future of health rather than just the future of healthcare, us reflecting on how is it we can involve that the largest workforce, the people who deliver most health and care in our communities, and that is individuals and families and caregivers who are part of those families or friends or community groups who also do an awful lot. And so I think if we uh, just remind ourselves that there's this large, almost untapped health workforce out there, or well-being workforce, that's a really important perspective for us to have as system leaders.
Yeah, and it's interesting. Actually, Winfred's asked a question around, what are the strategies or frameworks that you can use to sort of get away from this everything's important and everything's a priority, which is often what happens when you get, individual clinical leaders or service leaders in the room. They will tell you that the issue, the area they're working in is the biggest priority. And I suppose scenario planning is actually one way you can do that at strategic level. There are other strategy tools, but there are also, I think, day-to-day decision making matrices that can help drive that. But ultimately, they all come back to trade-offs. And I think once you start talking about options rather than solutions, it comes back to communication, it comes back to building trust, it comes back to building the widest possible consultation and information sources from stakeholders. And then, there are methodologies of, whether it's sandboxing or piloting to learn and propagate good. And I think one of the challenges, I've always felt in healthcare, one of our big challenges that, is we are so good at managing really complex risk, and we have, a do no harm approach, and we, are often quite rightly in governance and leadership focused on eliminating risk and error, that we sometimes forget that half the job is actually propagating good. And I think in crises where there's risk is so much higher, it's a real heuristic trap for healthcare leaders to think, oh my goodness, I can see risk everywhere. I need to go and reduce risk. Whereas in fact, perhaps more importantly, you need to actually go and pilot or identify those little pockets of good and think about how you propagate those. And I think that's what we see in the most innovative healthcare systems at the moment, often very low cost. An idea takes off, and it propagates itself. And the job of leaders is then to get out of the way and actually create the soil, if you like, for this
Mm.
new species to grow, rather than sort of be running around trying to manage the risk. Eleanor and Ash, I mean, Eleanor, I think, I was going to ask you a question around that. We asked you about team resilience, but there are actual practices and routines that teams can actually do. I think people are really looking for very practical things, and you mentioned when we had in our conversation before, small scale experiments. But what are some of those other things, that really practical things that teams can do um,
Yeah.
uh, in this space?
Yeah, so I mean, I think one way, excuse me, one way of having small scale experiments. Sorry, just bear with me a minute. One way of having small scale experiments is through PDSA cycles, so that's plan, do, study, act cycles. And other ways the sort of experiments can happen is through simulations, and that isn't just necessarily clinical simulations, but it can also be sort of simulations around crises or tabletop exercises to sort of work through how something might unfold. So I think there's many different ways of doing this. PDSA cycles are a particularly well-tested methodology in healthcare, and they enable you to do sort of small-scale innovation, test it out and sort of get good results before you then roll it out further in healthcare. So I think these are all elements that you can try adapting.
Mm.
Anything to add there, Ashley? Or
Yeah, just to build on what Eleanor has said, and I mentioned PDSA earlier on, and during our sort of crisis situation through the pandemic, we were in, of course, this highly accelerated, I called it the review, learn, adjust cycle. And a good friend of mine at the time ran our national health line, and they were critical in terms of getting information out to people and being a source of information, particularly around vaccination. But he reminded me that on one day their protocol changed 6 times in one day, just off the back of what we were learning and just adjusting. And of course, a real challenge at an organizational level to make sure all their operators had those updated protocols, but they did manage to achieve it. I guess the other thing we learned, and very often, we think of innovation and people talk about it as being transformational. I always get a little bit worried when people talk about transformational changes, and usually they're referring to structural changes. And of course, what we found, and I'm sure this was a similar experience in other countries, we had to implement a number of information systems and data and digital responses to underpin our both our COVID response and our vaccination program in record time. And the thing that made the one feature that made that possible was not going for perfection, but actually whipping up something that was just good enough, and getting it out there with a really good way to get user feedback. So, by the time our contact tracing system went through its 30-second iteration, it was starting to look quite good, but it was being updated on a weekly basis. And the first edition was put out there after 2 weeks. So I think there's a lesson here for us that often we make innovation rather too complex. And this is building on one of the questions that was in here from Tony. It's important to be innovative, especially in crisis, and we can minimize some of the unintended consequences or fragmentation by being aspirational in terms of where we want to go, but implementing it through that PDSA or that review, learn, adjust type approach, and changing incrementally and having really good avenues for getting feedback.
Yeah, thanks, Ashley. It's fascinating watching the chat. We've got enough questions to go for about 3 hours. So
Yeah.
we will try and come back to some fantastic comments there, some really terrific questions, and I'll try and capture that as we come towards the end. But you're both such experienced leaders. You've worked around the world. It would be remiss of me not to really ask you to give some personal advice to those online. And looking through the group online, we've got some fantastic leaders that we know joining us as well. But perhaps if I start with you, Eleanor, if you were advising a healthcare leader at the moment who felt overwhelmed by the scale of uncertainty and pressure, what are the two or three practical things you'd say to them that would be really helpful in sort of making that step change into a comfort level in dealing with these high levels of uncertainty, high levels of risk, and as many of our people online are pointing out, the paradoxes of, short-termism being rewarded politically, but long-termism being the thing that the system may actually need?
Yeah, that's a good question. I think I'd encourage people to review, their short, medium, and long-term priorities. In the midst of uncertainty, everything can feel urgent and there's a sort of pressure to get things done. But I think finding a way to take a step back and provide much needed perspective on what to prioritise, what to stop, what to pause, or what to postpone. And sometimes you can achieve that by sort of getting together a wider group of people who represent different sectors or different organisations, to help you do that, to provide that greater perspective. I think another thing that's really worked for me in my leadership career has been to build or join a network of peers. And you can do this in a number of ways. There's often quality improvement initiatives in a country where you can be part of that quality improvement initiative and join a group of like-minded peers. There can be professional bodies that enable this as well. And they can be people who understand where you're at and understand the pressures you're facing and can help to provide you with feedback, challenge, encouragement, and where necessary, sympathy. and can just be that sort of objective sounding board as a way of, stepping back and having that greater perspective.
That's fantastic advice, Eleanor. Ashley, what's your thinking?
Yes, well, two or three sort of tips from me. Well, first of all, ensure you've got a coach to act as a sounding board and help you keep things in perspective. And I had the same coach for sort of 6 or 7 years from the time I started as a district health board chief executive and right through my time as director general, including through the pandemic. And that was just invaluable. Someone who got to know me pretty well and would challenge me, as well as just making sure I kept things in perspective. I think it's also really important for us to remind ourselves as leaders that most people actually want us to succeed in the role, and they want us to ask them for help and support if we need it, and for us to be authentic and open about the challenge, to ask them for ideas. People don't expect us to have all the answers, and it's quite a relief to them when they find out we don't. And of course, it's a relief to us to just remind ourselves we don't have to have all the answers. So, reaching out to those around us as well, and thinking, because others, if we're struggling as leaders, others will likely be as well. Um, and sometimes, when we're wading into the leadership swamp, as it's often described, we forget to look left and right and remind ourselves we're not alone. And actually, we can support each other. And in doing so, that gives us strength and also helps us keep perspective, but also allows us to support those who are leading with us. Leadership is a team sport, and we go a lot further when we work as a team.
That's fantastic, Ashley. It was interesting. Asma has asked a great question, asking us what is the one leadership decision you made that looked right on paper but failed in practice, and what did it teach you about leading people? Well, I don't have any trouble thinking of numerous mistakes that I've made, Asma, but certainly the one that I learnt very early on was that sitting in my office doing spreadsheets and writing emails. Um, some of my plans and ideas didn't last very long when they contacted reality. And it
Mm.
certainly learnt, I certainly learnt the lesson very quickly that the quality of my decisions and the quality of the outcomes was very closely linked to how many people I'd spoken to, how many people I'd road tested the idea with, and
Mm.
how much feedback I was prepared to listen to. And so I think there is a real risk for leaders, particularly when you're busy or urgent, things are urgent, to retreat into the office or to retreat into a cocoon of people that you feel safe with, who will
Mm.
tell you what you want to hear. And I think, as uncomfortable as it can be at times as a leader, the best leaders are prepared to hear the things that they perhaps don't want to hear but need to hear. So I don't know if you've got any thoughts on that, Ashley or Eleanor, but it's usually the messages you
Yeah.
don't want to hear that you most need to hear as a leader, isn't
Yeah, I mean,
it?
having had interactions with people who are very resistant to change, which I think is quite a common, can be a common experience as a leader. I think it's about recognizing that those people actually are often passionate about the service they deliver and are resisting the change because they have really genuine concerns about what the change would mean for them. So what I've learned over the years is not to treat them as obstacles in the way, but to treat them as a source of information that can really and to really listen to them and to really understand what they're saying. And you can often end up achieving a much better outcome if you take on board their concerns and their feedback.
And I think that's particularly true as we face this. It's a topic we could talk on for another few hours
Mm.
around the use of artificial intelligence. There's a couple of questions in the chat around AI, but you know, like I certainly don't intend to start a 3 hour discussion on AI, but as you know, my own view is that we should never forget that we are in the wisdom business when we're
Mm.
leaders, and sometimes inexperienced leaders or leaders who may not have gone on that great transformational journey of discovering your true purpose and your true values can actually sort of get confused and think that access to a lot of information or being incredibly knowledgeable or experienced is secret sauce of leadership. I see them as really key ingredients, but the thing that actually makes leaders, exceptional leaders, powerful, influential, and successful is their ability to make wise decisions. And I'm not sure that AI has really, it may help us make wise decisions, but there's plenty of evidence in all industries that you can use a lot of information and very experienced people to make very stupid decisions. And so I think that the challenge in the most general form as we think about AI is to make sure that we're making wise decisions. And let's hope that AI is a great tool for that. Certainly, it's exciting, and from the, everything from, genomics through to agentic workflows and helping us even with things like recording and transcribing. But ultimately, for us as leaders at a systems level, I think we've got a lot of work to do, a lot of thinking to do to make sure that we end up using it wisely to make good decisions rather than be trapped by too much information or too much knowledge. I don't know if Ashley or Eleanor, you'd like to make a comment on that, because we know that the school AI is just something everybody wants to talk about, isn't it?
Yes, it is. And, I hold on to one of the first things I heard in one of the first AI discussions I heard, and it was actually a professor of AI at the University of Auckland. And he said, AI has the potential to help us be better humans. And if we keep that at the forefront, and this, of course, is absolutely relevant to the business that we are in and to the work we do in healthcare. If we harness AI and its extraordinary power and potential in the right way, it frees us up to do the things that only we can do, including making wise decisions, but also acting with kindness and always being able to care for people, even if we're unable to cure. We can care and comfort people, and AI, of course, is unable to replace those wonderful human qualities.
No, that's fantastic, Ashley. Thank you very much for that. Well, look, we are coming to the end of our webinar today, and it's been a real privilege for me to join Ashley and Eleanor in this webinar and to have such a wonderful cohort of participants. Thank you for all your questions. I should note that it's been Amanda put it in the chat, but you will be able to access a recording of this webinar, and we hope that you find that helpful. It's been a real pleasure having you online with us. Just to finish off, we just want to remind you that Ashley, Eleanor, and I, in a sense, the leadership team of the Oxford Healthcare Leadership Program at the school, and this is our executive education offering, really a life-changing experience for healthcare leaders, not only to immerse themselves into the Oxford ecosystem without having to do a long period of study, but also to take time away from their busy lives to actually interact with participants from all over the world and really broaden their lens and on what being a successful healthcare leader is, to hear from some of our absolute experts at the school on everything from strategy to performance to innovation, and to really be supported in that incredible journey that we go through to become hopefully very powerful and influential healthcare leaders. And so for those of you online, if you've not done the program, we'd love to see you at Oxford. The application deadline is the 24th of August, and starts in October, which is a beautiful time in Oxford, and we would love to see you there. And Eleanor, I might hand over to you because you are one of the senior people on the Masters of Global Healthcare Leadership, and you might like to talk quickly about that.
Yes, and hello to Maureen from cohort 2 of the Masters in Global Health Leadership, who's on the call. Yes, this is a 2-year Masters program. You join a cohort of extremely senior healthcare leaders from the global healthcare leaders who work through a series of about 8 modules on different aspects of healthcare leadership, from organizational leadership and personal leadership, all the way through to global health challenges. And I think for most, although we've critiqued the word transformational, I think many students who actually go on this program find it truly transformational, and have moved on to amazing roles and jobs subsequent to doing the masters. So I'd really recommend you having a look at it and thinking whether it's something you might be interested in.
Thanks very much, Eleanor. And we've got a QR code there if you are interested. And these are our friends and colleagues at Oxford who can help you out with information. And so these addresses, of course, will be on the webinar recording that you've got. But you'll find the Oxford team are very keen to engage with you, to hear your story, and hopefully join our wonderful participants and then alumni of healthcare leadership at, say, Business School and at Oxford, and the Nuffield Department of Primary Care at Oxford as well. So it's left to me really to thank you all very much. Eleanor, Ashley, thank you so much for your wisdom, for being so generous with all your experience, all your knowledge, and a great thank you to all of those who joined us online. We hope to see you in Oxford soon, and thank you for joining us today.